I'm sitting here with Rain from Tervisekassa, and they're the big insurer in Estonia. And they're also driving innovation. I'm going to talk about how he's using digital technology to basically innovate the healthcare system and also do the more mundane tasks like fraud detection and that kind of stuff. And Rain is a proper person to talk about it, but before he was director of this insurance company, he was the country manager of Microsoft, and he was used to basically work with thousands of people all over the world. So Rain, first, how is it to go from Microsoft to become a local director of an health insurance company?
When I finished my tasks in Microsoft, then I said that I want as interesting job when I had at that time, and now I can say that the last 5.5 years I have got even more interesting than I had.
Yeah, so it's really fascinating to be part. Okay, so we all know Estonia and it's digitalized and that kind of stuff. When you basically came to work for a state government agency, or it is state owned, and it has 2.2 billion euros to distribute over 10 million healthcare records. How was the level of innovation inside this company compared to what you're used to in the public sector, especially Microsoft?
Estonian government sector is pretty innovative already last 20+ years. Yeah. So there has been done many things, but we continued that journey, and I believe our task is to keep Estonian people healthy or help them to become healthy again. Yeah. And money is always short, which means that with the help of technology we can achieve many things which richer countries are doing. Yeah, but
actually what you told me in the previous conversation, the healthcare sector or the government sector is quite innovative with ICT, and in public sector, not always so much.
Public sector, we are using the digital life every day. Estonian people, when they want to interact with the government and also in the healthcare, then they can do it without leaving their home. Yeah. And especially during COVID time, those who didn't use it before, they had to use it. And they like it. And I can say that the patients in Estonia would love to have more and more the appointments, not visiting a doctor, but distant appointments. And as everywhere, doctors want to touch the patient. And there is some conflict which we are trying to help out with the technology.
Yeah, okay, so you want to basically move the healthcare sector forward. I mean, I went to the primary healthcare doctors, and they said, well, we have about 8,000 appointments a month. We do 25% by telephone, and we do about 1,000 with video. But the big majority, 60%, is still a visit in person. So it's not so digital.
It is going because you need to get the first very good experience, and when you have that one, when somebody either calls you back, video calls, or interacts you using technology, and you get the result what you expected, basically you get relief of your pain or your challenge, then you would like to use it next time as well.
Yeah, so you want to use the patient to drive it forward, and you also have 2,500 islands where you don't have hospitals and you don't have doctors, so people are forced to use it. But is there do you as an insurance company try to drive systems, standardized systems like video conferencing into the healthcare sector?
Yes, we are incentivizing, because as we are the only payer, I would say, for majority of the health challenges in Estonia, then if we incentivize the distant appointments, then hospitals are also going to use these.
Yeah, and primary care too, because although primary care doesn't get paid by visit, they get a fixed amount per patient per year.
Yes, but with the primary care we have lots of pilot projects, like starting with how a patient can define what are their challenges, not telling it, but either typing it or through some technology. And then it's easier to make a triage whether he or she needs visit immediately, whether this challenge can wait a bit. And that makes also doctors and nurses' job way easier.
How is it in hospitals? What percentage of the visits are digital and what percentage are on the phone and what percentage are in person?
During the COVID time, as everywhere else, I believe when you had full lockdown, then all the visits were digital. Unfortunately, when the lockdown was gone, then doctors wanted to see patients. But those patients who are living really 70 kilometers from the hospitals, they said, dear doctor, is there any possibility that I will not come, but we will have the video conversation? And in these times, these are happenings. Of course, I see the potential to have more video consultations. And I can give one idea more, that what we would like to move is talking or using the chat, because I see the experience from our northern neighbors that in the private healthcare, one doctor can chat simultaneously, like playing chess simultaneously with the 6 patients, because patients typically are typing slower, they are thinking, and you can think how much time you can save. When
and the doctor can also use voice and that kind of stuff. So you've asked, Microsoft has been very much moving forward with ChatGPT, right? Integrating it. Of course, you still have contact with your colleagues. Are we also going to see a movement forwards of AI systems in the Estonian system?
Yes, what we are doing right now is, you mentioned earlier the word fraud, because we are responsible for saving or using wisely the 2.2 billion our health insurance money. Then already a few years we are really using system to prevent fraud. Our partners are calling typically these, oh, this is a human mistake which will not happen again. And nowadays the machines are getting smarter and smarter, and you can't submit us invoices because we can easily check them. And
you have to be more sophisticated to do fraud.
I would trust on our analytics department, because there are many people who have PhD degree, and yes.
Yeah. How many people work in your company?
200 people, and really responsibility and freedom is the way how we do it, and that's the only way how we can manage with 200 people.
200 people and 2 billion. So everybody gives 10 million per person.
Yes, mathematically, yes. If you do this calculation,
everything does automatically. But it's a machine which distributes the money, but it's a very efficient machine. You don't have too much people running around for that kind of stuff. But I mean, that you said chatting with 6 patients at the same time would be very nice if you have some intelligent, language model helping to be efficient. Are you already looking at that or incentivizing that? I think you have an innovation fund, right? You have 10 million, which you give into innovation fund. Where do you put your that kind of incentive?
We are supporting the projects which are bigger than 500,000, and the important is that not just a single party is doing it, but there are like many institutions, and there is a cooperation element. I can give a few examples, like what we did, stroke project some years ago, started the pilot project because there are 3 phases when you have stroke, like the most intensive phase, but after that one comes rehabilitation and the after treatment. The question was how the people could really pass this journey, and we made it way easier using technology, using some assistant in between, and we are measuring the results before and after, and we have some data from the previous times, and we see that adding some money, basically there is a big quality jump upwards, and it really makes sense to do it, and these came through these innovation projects.
Great. Hey, you also have to budget the hospitals and the healthcare providers and that kind of stuff. So you also have all that data. Do you use that data to make the whole process of discussing budgets and prices more easy?
Absolutely. Earlier, we spent months and months during our 20 hospital leaders to discuss budget, and the message was always the same, that why we can't do that one, and to do that one we need more and more and way more money. Mm-hmm. We are using the analytics. We are preparing the share what everybody is getting, and we invite everybody in the same time at the same time in the
No, you put all these presidents in the same room, and then you give them the whole budget at the same time.
Yes, and last 2 years we did it electronically. So basically over the Teams, everybody were sitting in their own premises. They saw, and the trick is that if the hospital leader feels that I don't know what will be my growth, when they see that the others' growth is not significantly different, and if it is, there is an explanation, and then they find a way how to survive. Plus, of course, we are listening them. There are two components. One is analytics. One is not Excel. There is a way more sophisticated system, but also you need to talk with your partners. Yeah. You need to listen them, and then make the right decision.
Okay, so very interesting how to do that. Hey, we're coming with 30 people, or we're coming to Estonia to basically study it. When people come here, what would you like to tell them, and what kind of discussions would you like to have with these healthcare executives?
I would love to share the experience, because we can tell brutally honestly how we did it, what we are going to do it, and also we can reveal and tell what didn't work. Because and that is what I also expect to hear from these conversations, because I believe that it's not so common to talk about, oh, we tried that one, but we failed miserably. Mm-hmm. And I can tell some stories of these areas as well. In return, I expect some knowledge from the touch system as well, that what have you tried which we haven't, and which works and which does not.
Okay, we'll see you in May. Thank you very much.
Thank you very much, and welcome to Tallinn, waiting you.